Hello friends, I am Dr. Finny, a consultant endocrinologist at the Believers Church Medical College Hospital in Tiruvalla in central Kerala. Today I would like to just share with you some of the common illnesses we see in relation to the thyroid gland. Thyroid diseases are quite common in the population. However, only about 50% of patients do present with typical symptoms leading to underdiagnosis of this particular condition. Hypothyroidism is the most common of the thyroid diseases which we come across, and in my practice, as with many other endocrinologists, we see that about 5 to 10% of the Indian population can have hypothyroidism in the mild to the severe degree. Hypothyroidism, how do you recognize it? Recognition is by symptoms such as unexplained weight gain, constipation, tiredness, dryness of the skin, fatigue, depression. These are some of the common symptoms, and in women, many of them have excessive bleeding during the periods. So these are some of the common symptoms of hypothyroidism. The good news is that this is a fully treatable condition. In majority of the patients, we can get rid of almost all their symptoms by regularly taking thyroxine, about 100 micrograms tablets once a day, every day. The only important thing to remember is that this tablet thyroxine has to be taken on an empty stomach the first thing in the morning, and the patient remains on an empty stomach for at least half an hour. And in almost all our patients, we advise them to take this lifelong. And this is an important thing, that the lifelong nature of treatment is to be emphasized. Hypothyroidism can also present in men, but it's far more common in young women and middle-aged women as compared to men. The other common illness which we see in relation to the thyroid is hyperthyroidism, where the thyroid gland overproduces the thyroid hormone. And the symptoms are usually unexplained weight loss, tremors of the hands, palpitations, sweating, and a lot of behavioral changes of being very jittery, irritable, and getting angry. These are some of the common symptoms of hyperthyroidism. The good news is that even this condition has got good treatment options. We can treat some of them with medical treatment, that is tablets such as carbimazole and PTU. Some of them we need to give radioiodine therapy, which is actually a very simple procedure with hardly any side effects. And thirdly, in the rare situation, we may have to offer surgery where we remove the thyroid gland in this condition. Thyroid cancer is something which many of us are afraid about, but this is a very curable type of cancer these days. When patients and people have a small nodules in the neck which is suggestive of a thyroid cancer, we get a lot of anxious patients coming to us for that, and this can be easily diagnosed and treated with simple needle tests called the FNAC and some blood tests. But the good news is that thyroid cancer is an eminently curable cancer these days, and we do not have to be anxious and worried so much about this. In summary, thyroid diseases can affect mainly women, but it can affect people across all age groups. And the important thing is to diagnose it in time and to treat it, and you can live a near normal life. Very rarely do we have to stop thyroid treatment. Most of them we recommend lifelong treatment. So as you can notice, thyroid disorders affect almost any organ system of the body, but the clues may be helpful to check it, and this is an eminently and a treatable condition, and I would encourage you to do thyroid tests periodically, especially if you have a family history or if there is a swelling in the neck. Thank you.